Hello and welcome, Arsenal Nation, to session 4. And bringing us home today, we are going to find out about how we can level up and use the science of video games to accelerate awareness, education, and adoption. So, our next guest on Reimagined Biopharma Showcase has been recognized by Fast Company as one of the world's most innovative companies in 2021. This company has also been lauded for stepping up and moving quickly at the outset of the pandemic to help doctors brush up on airway management, intubation, and diagnosis. On behalf of Arsenal Advisors, I am thrilled to welcome Chief Revenue Officer of LevelX, Tom Donnelly, to our program. Tom, welcome.
Thank you, Eric. Thank you. This is an amazing opportunity, and I've, as we just talked about, I saw several of the presentations today, and it's just a great thing to be a part of this. I'm really looking forward to the next hour with you guys.
Well, it's been dynamic and exciting for sure, and the excitement continues. So, Tom, can you share with our audience the LevelX story? How did this journey start, and what problems were the founders solving for?
Yeah, great question, Eric. It's actually a story that our founder and CEO, Sam, he tells this story quite a bit. It's very personal and close to home for him. So, Sam Glassenberg, the founder and CEO of the company, just worked his entire career in video games, right? At stalwart companies like LucasArts and Microsoft, but he was considered a black sheep in his family because the majority of his family are doctors, including his father, Dr. Sam Glassenberg, who was an anesthesiologist, a very prominent one at Northwestern. And he asked Sam, with his video game prowess to, develop something, an experience, a game, an application, a solution to help doctors learn to train on fiber optic intubation, right? Which is really tricky to learn, and it's very highly visual, right? So Sam, sat in his basement and did his thing, and next thing you know, he launched something in the App Store in 2012, and Dr. Glassenberg was using it to work with some of his doctors, and Sam went back a couple of years later and just like, let me see how this thing's doing. Is it really working? Is it just my dad who's using this thing? And he noticed 100,000 doctors and other HCPs had downloaded the app, right? Not only that, but there was an efficacy study done that showed it improved physician performance, right? So that was just kind of like, wow, that was the moment. He realized that everything he does in his day job, the kind of neuroscience of video game and video game mechanics really is a seamless integration, giving doctors the ability to kind of navigate on their own, learn by doing. And from there, it just took off.
Wow.
Yeah.
And that really kind of answers the first question that kind of jumped to my mind, Tom, as I was preparing for this is, do doctors really play games? Are they willing to play games? And clearly the answer is yes. Can you expound on that?
Yeah. So it is the question that I would say we get probably more often than not with our first engagement with the client, right? So we're going through our, capabilities demonstration, and we're, that question will always come up. And quite frankly, Eric, when I was researching joining LevelX, I had to look up the answer to that question, right? I thought the same thing. I had the same question. And then, my research kind of led me to a certain place that was like, absolutely yes. And then, when I talked to the folks at LevelX and then being here for almost a year, it's very, very clear that the average age of a gamer, is 35 to 40, and 50% of our player base is at or above that range, right? So it's not only for doctors, it's also not for younger doctors, which is also kind of a perception, right? So absolutely.
Wow. So this is fascinating. So there's no doubt, based on what you just described about your company's value proposition for clinicians staying sharp on disease states and procedures. What is the value proposition of these solutions for biopharma and medtech executives watching today?
Yeah, right now, it's just getting in front of the HCPs, right? They're busy professionals, and it's been hard for a while, right? Like no-see docs, no-see hospitals. When you get their time, they're distracted. And the pandemic, I think we can all agree, based on some of the presentations I heard today, have certainly accelerated that, right? So, and then you think about digital or NPP tactics. And again, I spent the last 15 years on the advertising side of healthcare, right? So I know this space very, very well. It still requires a lot of effort to drive, the professionals to that tactic, right? So, and advertising can be helpful, but when you think about, you have to, number one, find them, interrupt what they're doing, and then get them to listen. You're working very, very hard to make that happen. So I think the value of our solutions is really kind of not just the engaging experience, which we'll kind of walk through in a little bit, but it's the way that we can deliver it. One-on-one, peer-to-peer, KOL-led, asynchronous, synchronous, download to an app. So that's kind of the real value proposition. I think it's really, giving the information where they are, when they are. And I know that's kind of a cliche, but that's really what we do. And again, I was listening to the omni-channel presentation earlier, and this is exactly kind of the value add that we can bring. It's the experience, but then the delivery mechanism.
I tell you what, you hit the nail on the head. And I can share with you just from, after my 20 years of leading product launches in pharma and the endless sort of secondary launches of new indications, disease state awareness, it's quite a challenge keeping our teams updated and confident while also staying on point, driving the current business and their remit, right? So I guess my question is, how might LevelX help commercial learning and development teams solve for these persistent challenges?
Yeah, good question. I think, this is where our remote play technology, and again, I'll talk about that and show you what that looks like in a very short period of time. I think that platform is a perfect fit for your question. With remote play, essentially, sales forces have these highly interactive, experiences, engaging learning environments, to kind of supplement the hands-on face-to-face calls that reps have with doctors. And if they can't, then they have that same experience. It's not just your typical Zoom call where it's kind of one-to-one. You'll see that they actually interact with the same experience at the same time with the doctor, right? So whether it's diagnosis or treatment pathways, it's all done kind of at the same time. So, it's introducing these new products and concepts and driving an active discussion in addition to the sales call or beyond the sales call. I think that's really the kind of the value proposition that we kind of think about, and where remote play has a place into that.
That's really cool. And it just sounds like it's a more dynamic experience that really can pull the end user into the experience. Exactly. And my phone is blowing up. So I've got a couple questions that are coming in. So I was just gently reminded by one of my friends in medical affairs, if there is potential there with regard to CME and things like that. I think we've opened Pandora's box because my colleagues in brain health and oncology are asking me this as well. In short, are there any brand topic or limitations to your applications?
The answer to your second question is no. The answer to the first question about CME, in fact, we actually have CME credits available in several of our existing apps. So right now we have 4 apps in the App Store that are downloadable for free for our HCPs. We're launching a 5th one in the App Store in June of this year. And there are CME credits available in those apps, which is amazing. And then I'm also going to talk about, to the second part of your question, just to kind of revert back to that, is a Huddle Up platform, which is kind of the first of its kind cloud-based technology that really allows a key opinion leader or an MSL or somebody that kind of really understands the data and the science, to talk to their peers in a virtual setting that is different than, like, again, a Zoom, or it's very interactive and hands-on, learn by doing mentality. So, and it's applicable to any therapeutic area. I know you said brain health, and I think you said oncology. Yeah. So check, and every other therapeutic area, check.
Wow. Outstanding. Well, Tom, without further ado, the floor is yours, and we'll check back in.
Fantastic. So I'm just going to share my screen here, if you don't mind. Just give me a second to get it set up, and then we'll jump into it. Okay. We just present this, and then we're ready to rock and roll. All right, Eric, can you see my screen?
Sure can. Looking
Fantastic.
good.
Great. So we'll go through this. Some of the stuff that we already addressed, obviously, in the Q&A, I'll kind of speed through. I don't want this to be kind of a boring slide presentation. But just to set up the scenario here, and this is not going to be a surprise to anybody, listening or watching. Generally, healthcare has been in the middle of this kind of, this digital evolution for a while now, right? And I think COVID has definitely, accelerated that. Interactions are definitely becoming more personalized, customized, and digitized, right? Again, probably table stakes for anyone that's listening to this, right? But then you kind of think about pharma's facing this major challenge, like how do you engage your doctors in a virtual setting? Does it have the same impact? How do you, what do you do? Are they listening? Are they distracted? Does pharma have, pharma med device have the right tools at their disposal? And Zoom calls just aren't enough, right? So again, I'm used to developing these types of marketing plans, for years and years and years. But is that enough in this day and age, right? So, that's where we come in. Again, the accelerating the brand awareness, education, and adoption, table stakes for what we're trying to do. The difference that Level X brings to the table and what we're going to spend our time talking about today is how we do it. And that's state-of-the-art video game design and technology, right? That's the difference. That's the secret sauce. And again, this is kind of the founding story, so we're not going to talk too much about this, right? Sam working at LucasArts, Dr. Glassenberg, Northwestern Medicine. And then now, right, it's evolved to having the best video game designers and producers and technologists on the market. I mean, the people that work at Level X on that side of the business have been responsible for developing games that are played by hundreds of millions of people every single day throughout the world, right? You combine that with the right side of the screen, we partner with and have employees of, the best medical institutions of the world, the best healthcare agencies in the world, and the best med tech companies in the world, right? So that's really kind of how we combine the skill sets to do what we do. And we're partnering with, what I like to call some of the most ambitious pharmaceutical companies and medical device companies to really develop solutions for them. And I purposely say ambitious because what we do is different, and it's not typically on that marketing plan sketch that I showed a couple of slides earlier, right? So, how do we push the boundaries and really think about changing the paradigm and how we educate doctors? We really fundamentally believe at our core, without question, this is the future of HCP interaction, right, for pharma brands. This is the level of interaction that we think doctors are going to expect in the future. So that's just very, very high level about who we are and kind of how we came to be. But I think this is the important part, right? How does this thing all work, right? How do we talk about, applying the neuroscience of game design to really educate, our doctors? And so, there are definitely proven methodologies around this, right? Games in general throughout, history uses the principles of neuroscience, right? Think about reward pathways and changing behavior at scale, just playing over and over and over and learning and adapting and growing, and this is really just based on, the neuromechanics of learning and skill development. And if we kind of just take a look at this, traditional marketing tactics, right? And I'll just, a couple banners, websites, they really provide what we like to call passive learning, right? We're focused here at Level X on that active learning piece, right? So bring people together, meaningful retention, releasing that dopamine, wanting them to come back, enhance their skills, increase recall, behavior change, things like that, right? And so, again, meaningful retention. You're going to hear the word retention in a little bit because, our data kind of proves that out. And so here's kind of like at a very, very high level, right? How this all comes together. We have, and this goes back to one of your first question or second question, Eric, do HCPs and doctors play video games? Well, that first circle, we have 700,000 healthcare professionals, right? So not just doctors, but also other healthcare professionals, have experienced level X games. Now here's this middle bucket's my favorite, right? When you think about how much time a rep has with a doctor, maybe 3 or 4 minutes if they get time, how much time a doctor spends reading an email that is sent to them, or another educational piece of content, maybe 30 seconds, maybe 40 seconds. When a doctor experiences a level X game, they spend 13 minutes per session, right? And then 9 out of 10 times, those doctors show improved performance. So we capture the metrics from very start throughout the process. Anything we can capture, we capture. And we show very clearly that there is improved performance throughout, right? So, we'll talk about some more metrics and data that we capture, but really just at a high level, this kind of proves the point. Do doctors play video games? Not only do they spend a lot of time and they're learning, so it's working. So, when this next few minutes is really the solutions, right? It's what we offer to the market. And it's in 2 ways, and we talked a little bit about this in the Q&A as well, where there's interactive solutions, but then there's also flexible distribution options, right? And so we'll kind of walk through those because I think there's a little bit of nuance there, and it really speaks again to the omni-channel presentation that was a little bit earlier in the day. So if we think about capturing the focus attention of HCPs throughout a brand lifecycle, and these are just some examples, right? But if you think about, reasoning skills to correctly diagnose a patient, right? Yeah, we've got games to do that. Enhancing critical thinking around treatment decisions across a variety of different patient types, right? So if you've got, a certain medication that treats, different patient types, yeah, it doesn't just have to be one patient type and one decision pathway. It can be all of those, and we can kind of build that into an experience. Then you think about stay up to date on clinical best practices, right? So what is latest and greatest, and how do we update that, and making sure that we're learning and know what it is. And then, one of the things that I'm most excited about is really thinking about how we help clients reimagine their MOA story. So how will we get immersive experiences in MOA? Because we all know that MOA stories exist, right? And most brands have one. But how do we take that to the next level and really make it an immersive learning experience? And then finally, explore clinical data in a brand new way, very illustrative, and being able to really manipulate and look at data in a way that really has not been done before. So that's kind of at a high level, the solutions. And then if we think about, any one or all of those solutions can be distributed in a number of different ways, right? So is it a mobile application for asynchronous learning? A doctor can download and play on his or her own time. An AR/VR experience. We'll talk about these last two in a second, but cloud-hosted platform, again, that's that remote play platform that I was mentioning, Eric, a little bit earlier, and peer-to-peer solutions, which is the Huddle Up platform that I was talking about a little bit earlier as well. We can go through each one of these very, very quickly. So if we think about remote play, it's a cloud-based gaming platform. And what this does, and only a few companies in the world actually have this type of technology, right? But ultimately, it allows users to engage with the same content at the same time. It really kind of bolsters that community with interactive events. As I mentioned earlier, reach your audience anytime, anywhere. And it really kind of allows you to unite your sales rep or MSL and HCP to simultaneously, interact with the same content anywhere. That remote play can live on, it can be for sales detailing programs, website, booth augmentation, and peer-to-peer. And I'll show you how in a second. And it's simple. It's simple. If we think about a sales rep detailing example, So a rep would share a link or a QR code with a doctor. The doctor scans the QR code or clicks the link. Boom, they are in the same virtual experience. That easy. You don't have to download anything. You don't have to have a separate app. You can do it on your laptop, your iPad, your mobile. It doesn't matter. It's just that easy. And then the doctor and rep or MSL are interacting with the same experience. And if we think about, we build an experience and you want to have it doctor rep, but you also want doctors to have the ability to go kind of do this asynchronously on their own time. We just put that same experience on your website and doctors access it the same way. And boom, they're having that same experience. So again, it's the multiple distribution channels. A third one is, again, booth, whether it's virtual in the times that we're living in now and what we're doing right now, literally, or in-person booths. And then finally, kind of in a peer-to-peer setting. So we have this platform called Huddle Up. It really is the first virtual peer-to-peer education platform built on game design, right? So it brings, groups of physicians together in real time to collaborate, learn, share best practices. They can diagnose disease, they can manage patient health, and it's in a closed remote environment. So, there's this social component to it, and they're interacting with each other all via, your any web conferencing technology, right? So it's a fantastic multiplayer experience between doctors. And then from a measurement standpoint, Eric, I think it's kind of interesting that, we've got these learning KPIs that, again, I'll go back to the term table stakes that I think everybody needs to bring to the table. But really where we're focusing on, and we focus on that, but really where we're trying to focus on is the behavioral KPIs and the impact KPIs, right? So are the doctors learning? Are they spending the right amount of time doing the right things that we want? What is their satisfaction? And then ultimately kind of leading up to a return on training, return on education, return on investment, those types of impact KPIs that we do partner with some of our clients to kind of build out. So and the final slide that I have, and then be happy to take any questions, is we're really excited. As I mentioned, we have 4 apps in our app store. And then we're launching a dermatology-focused application based on entirely new game mechanics in June. And we went through user testing, we went through beta where we invited some of the top dermatologists in the world to come interact and play this. And the results have just been mind-blowing. So we're really, really excited to put the finishing touches on this and get it out to the market. So that's the presentation itself. One of the things I will say, though, is we debated, and generally we don't like to do demos, right? The proof is in the pudding, and I think it's important for you to see, to really feel and understand what we're doing. But given the technology challenges sometimes that we see at these virtual events, we feel it's best just to kind of, if you want to see a demo, if you're interested, if this meets your needs or you think it might, reach out, and we'll be happy to kind of give you a very personalized demonstration experience.
Outstanding. I'm a little gobsmacked, Tom. This is amazing. And I think the thing that really stands out to me is the results that you all are already delivering for patients by helping doctors in the pandemic, for heaven's sake, to be able to pivot and move and calibrate a functionality like that is impressive. And again, like what this conference, the Reimagine Biopharma conference, is all about is the end user in all of this are patients.
That's right.
And that's super encouraging. And it sounds like there's some flexibility within the platforms too that are just going to be helpful and meet different needs of different organizations depending on what they're doing. So I was going to ask that if you want to put the slide back up with your contact information, because
of course
we're going to get a barrage of requests in our email box at the conclusion of this conference. So at this point in time, I'd like to invite my fearless leader back into the queue to see if there's any questions that have bubbled up besides the people neurotically texting me during the presentation with questions. You're on mute, Frank.
How about that? Better?
Yes.
Sorry.
All right. So let's see here. So one question is, Tom, can you help us think about any disease states that are particularly opportunistic for leveraging this technology?
Yeah, it's a good question. And so I'd really say, I don't want to leave any out. So, we have the apps that we currently have existing in our store: cardio, gastro, pulm, and airway. Again, dermatology is coming, but really the experiences that we build are across, I could probably say we work in almost every therapeutic area out there in one way, shape, or form. And that's kind of the interesting thing. And one of the reasons that I'd rather do like a one-on-one demo if possible is because we can kind of, contextualize it and tailor it to exactly what you're looking for. Because a dermatology experience is going to be very different than an oncology or a neurology experience, right? So, but there really are no roadblocks. I guess the high level answer is there really are no roadblocks in terms of therapeutic areas. Rare disease included in that, all the way through obesity and airway management. It really just does span the gamut.
Excellent. Next question is, how difficult is it to repurpose perhaps the beachhead project for other use cases within an organization?
That's how we build them so they can be repurposed. In fact, again, going back to, I think the great question that Eric asked in the beginning is kind of the value proposition. And that really is the distribution mechanism, right? So it's video games for doctors, right? So the neuroscience of game design, all of that stuff, which I think nobody else is doing, but then we build it once and it can be repurposed in kind of any medium that makes sense for any channel that makes sense for the specific client. And again, we can make it synchronous, asynchronous, both. It can live anywhere at any time. And that's really, I think, to me, that's the value proposition, especially as we're talking about living in this omni-channel world, right? Like we've got to be prepared to have this experience available to whoever wants it, whenever they want it.
Yep.
And one of the standout things to this is when I look at kind of the old modality of how we learn in pharma, and back in the day, I'm probably dating myself a little bit, we'd get these massive binders and it was super didactic and even for lifetime learners and lovers of learning like yours truly, it just was a little bit grim, quite frankly. And the fact that you all are leveraging the neuroscience of piece of, releasing dopamine and making it engaging and, dare I say, fun.
Fun, exactly.
And isn't that, if you think about it, I can just see people really looking forward to learning new indications. And I can tell you, when we're running hard in pharma, we got our heads down a little bit, driving engagements with our customers and just trying to keep up. And sometimes when you get a new indication, it's intimidating because you're like, whoa, I've got modules. And back in the day when I first started, man, like you had to pass those modules. It was kind of like a little bit of an existential threat, so cortisol levels building up and stuff like that.
No question. And it's actually,
which aren't super conducive for learning, right?
Absolutely. It's a really good point. We're actually building for one of our clients, we're actually building a sales training experience as well. So generally, our thesis and mission is to educate doctors, but one of our clients was like, wow, this is so powerful. I'd like it to use it as a sales training tool. So we're building actually an experience as a sales training tool. Just to kind of lead off what you were just saying, Eric, from being in the industry, that's going to be, a very interesting experience where it's actually, they're going to test in and out and their qualification is going to be based on going through our experience, right? And we can kind of track it all the way through. So that could be an interesting new use case.
Very cool.
Okay, Tom, I've got a couple more. Are we good to keep
Oh,
going?
I'm good. Yeah, no, this is great.
I mean, these are really good questions. What I love about these questions, and I want to compliment everyone who's asking them right now, is that you are seeing yourself leveraging these innovations. And to me, that's where this whole thing pays off is, are we connecting people and ideas that can transform the industry? So Tom, the question is, as messages and priorities change with the brand, how difficult is it to incorporate updates with a fully built project?
Yeah, no, it's fairly simple. I would say it's the same as it would be for most other marketing tactics, right? The interesting thing here is, again, you do it once and then it goes across all the distribution channels, right? So I don't think, there are certain games that we build where, I'm gonna simplify it, and I don't come from the game side of the business, so I may get crucified for saying something like this, but it's something as easy going into a spreadsheet and changing some terminology or some language or something like that, right? Fairly easy. But if it's a core mechanic or a core something structural, it's probably no different than any other marketing tactic. But again, the value you get out of this is you change it once and you only change it once, right? And then it kind of permeates throughout wherever it lives.
Excellent. And now this is a tough question. This is like the famous, what does a house cost question? Like, you mean in Boston, you mean in LA, you mean in Maui, you mean in Sheboygan? So the question is not necessarily about cost, but how challenging is it to get a project like this off the ground?
Yeah.
So help us out, Tom.
Great
Is this a high friction thing?
Outside of, the question, do doctors play video games? This is probably the second most asked question that we get. So I love that people are thinking about it this way. So there's a couple components that I think are really, really important. We build every single game with MLR in mind, right? So this is not one of those things where it's, hey, let's build it and hope it gets approved. Or we hear, again, I come from the agency world, let's get MLR involved early. That only works to a certain extent, right? That's their job, right? To protect the organization. So we build these things, and we have, research and partners where we actually kind of, get MLR folks from industry to consult, right? While we're building these things. So getting it off the ground from a purely operational standpoint, fairly easy in that sense, right? So as long as we come up with the experience and the actual goal and the objective, and we kind of build it around that, fairly easy. From a price perspective, again, I'll go back to my stock answer. It's generally the same as any other marketing tactic, right? But the benefit you get is you pay once and it lives across a bunch of different channels. It's no more expensive than, building a very comprehensive, website or something, right? So, and it can run the gamut. If you're looking for a very simple, diagnosis experience, because that's the challenge, it's X. But if you're looking for the whole gamut of offerings, it's going to be slightly more expensive. But again, it competes it's very competitive with any other marketing tactic that any brand manager or MSL would see on their brand plan.
Tom, you're getting crushed with questions. The next one is, this sounds like a profound idea. Does this typically come in through the agency, or are people in-house in brand making decisions to incorporate this into their marketing mix?
Both, but the large majority of our deals and relationships are directly with the client. So we have a couple where the agency will recommend us, and again, I come from that world, so I know it very well. But then once we get into the build, instead of being a pass-through through the agency, we work directly with the client. But again, 9 times out of 10, it's directly with the client. Excellent.
That makes a lot of sense. Okay, so there's a few questions that have some similarities. So everyone, thank you for submitting them. So I'll paraphrase. Tom, with the advent of what's happened with COVID-19, and fewer interactions between healthcare professionals and industry, do you have any data or observations on the consumption going up or down with this type of technology since the pandemic hit?
Well, consumption is definitely going up, and the corollary to that is our client base is increasing significantly, right? So they're looking for means to get solutions out there to their doctors, right? And so, this is one of those solutions where they're saying, wow, even if post-pandemic, I think, there's been plenty of studies by the top-notch consulting companies that said, reps are going to see doctors post-pandemic, but it's never going back to the levels that it was pre-pandemic, right? And I think, clients are starting to really realize that. And that's why we're seeing kind of an uptick, right? So that's in the experiences that we custom build for clients. And then that same thing holds true for the apps that are free and to download for the doctors. There's definitely a high level use case where, usage is just, it's really climbing. Now, again, that also, I want to be clear, we also market those apps, right? We have an entire marketing team that drives doctors to use that, but the clients demanding that that happens is really increasing, right? So usage across the board, custom and free downloadable apps increasing significantly, which is good for business, of course.
Excellent. And the final question that we'll take on today, Tom, and I'm encourage everybody to reach out to him and the team at LevelX, especially for a demo. I think there's some interest there for sure, but we're not going to be doing that here today. Again, paraphrasing Tom, I think the essence of a few of these, questions, is around time to implementation. Is this something that, like, if we said we want to do this in 2021, that in fact it could be rolled out before the end of the year?
Absolutely. Yeah. I would say, anywhere from 6 months is generally a project length time. So we're still definitely well within, the time for 2021. And then there's also drivers, like with anything in our industry. And again, we spent a lot of time in this industry. If you say, hey, we've got this big conference, we've got a POA, we've got a drug launch, then we talk about the timelines and we try to accelerate the best we can. But generally, order of magnitude, 6 months or so.
Gotcha. When you mentioned MLR, I'm just having flashbacks to the countless MLR meetings I've been in, and I'm thinking that you guys can probably stamp this out really, really fast. But on the pharma side, can we keep up with you? So,
no, that it's a good question, and that's why we always have kind of our third party kind of market research team not only bring the marketers and the sales folks and the education folks and MSLs into it, it's the MLR folks too, because we don't want to go too far down the development cycle with a core product until they say, yeah, this is something that will fly. And by the way, I think it's an important note that it varies significantly, as you probably both know, between, let's say, just big pharma and small biotech, right? Like one molecule versus, a multi-billion-dollar organization. The MLR processes sometimes differ, so we make sure that we bring both sets of eyeballs into that conversation to make sure we're well covered with what we're developing.
Outstanding. Well, Tom, from my perspective, thank you. I'm going to give the floor back to you, Tom, and to you, Eric. If you two gentlemen could simply kind of like close us out, as well as where do we go from here, from your perspective on this topic?
Well, if you look at what the Reimagine Biopharma Innovation Showcase is really all about, it's taken these developments from innovators and paying them forward, finding ways to engage your clients, your markets, your internal structure to see if anything from today is worth pursuing. And that's really our goal and our mission at Arsenal Advisors. So in terms of LevelX, I'll hand it off to Tom in terms of any final comments to Arsenal Nation.
I just want to thank you and Frank, Eric, for inviting me here today. I do think what we're doing is really game changing. And one of the reasons I joined LevelX, for just a little sidebar, personal story as we wind down, is, every single pitch that I was on, every single brief that I received from my clients always said kind of two contradictory things, right? Be innovative, do something that no one else is doing, but it must be MLR approvable, right? Like, and they always kind of, and LevelX is one of the first organizations where I really felt that this really truly can come to life, right? We can do something that nobody else is doing. really educate doctors the way that they want to learn by doing, learn by engagement, and build it in such a way that there's really no hurdle to get this approved within the organization. So thank you for inviting me. I really enjoyed this experience. I enjoyed a lot of the presentations today. I thought you guys did a great job, getting the right presenters here today. But in final closing, I would just say, if you're interested in learning more, hearing more, reach out to me. You can reach out to me personally. You see my email address here, tom.donnelly@level-x.com. Or, just go to our website and we have a partnerships page and you can kind of just fill in your information and I'll reach out to you ASAP. But I really look forward to engaging with any of you that reach out.
Outstanding. And we will exit this portion of the broadcast on that note from Tom. Donnelly, thank you. And thank you, Level X, for stepping up and showing us what the possibilities are to be game changers.
Thank you, Eric.
We'll actually have a final recap for day one. Frank and I will be available on LinkedIn Live. So on behalf of Arsenal Advisors, thank you everyone for attending, and we look forward to seeing you tomorrow.